Hello everybody, we're going to show you how to set up a home sleep study today. So we are going to start with Coley, our lovely assistant, and I'm Crystal from the TMJ and Sleep Therapy Center. And we're first going to start with the booklet that comes in the home sleep study, and it actually comes in each of them, and it gives you pictures and directions and goes through everything. But I'm going to go through it with you and show you how easy this is, because it's extremely simple to do a home sleep study. All right, so Coley. So the first thing you're going to do is you're going to start with the Metabite, and you can read it, that's facing up, and then there's a strap, and I'm going to fit that to her chest area, and then there's little black dots, those are going to be facing down. So go ahead, yep, perfect. This is way too big for her, so we're going to tighten it up big time. Coley, can you hold that in the middle and just turn for me? And we're going to tighten up these straps so that it works for her. Okay. All right. Good?
Yes.
Okay. So we've got the top strap tight enough. And then we're going to do the lower one too. You don't want it so snug to where you obviously can't breathe, but you want it so that it doesn't move around while you're sleeping. So we're going to put this one around her waist, and again, go ahead and turn for me. Perfect. And as you can see, we're going to snug it up really good so it stays right on the ab area. Okay, and then Coley, I'm going to have you place that at your belly button for me. Exactly. So the next thing we're going to do is attach two black wires. These are the exact same wires. So they're going to go in here, in the bottom. And there's directions on all this as well.
I can get closer.
Yep. So they go in the exact same spot, and they're the same cord, so you can't switch them up. And then on the other side, if you can look close, it says abdomen and chest. Can you see that? Okay, so I'm going to hook up the abdomen cords to this lower abdomen waistband where she has it at her belly button, and I am going to hook up the chest one to the chest cord. And there's these little clear things on each cord that actually tighten it, and we highly recommend doing that. And we always have the patient tape it to their t-shirt so that it doesn't move around during their sleep, because a lot of us do move around during our sleep, and that's pretty normal. The next thing we're going to do is put the nasal cannula on. If the nasal cannula is sticking out, we just have them twist it towards themselves one time, and then it goes tight against the lips, and the little cannula pieces go inside the nose. And then we have them tighten. The same clear things are on these, and I have them tighten those as well. And each patient gets their own nasal cannula, so once they've been used, they get tossed. Okay. So then we're going to put this little hose in the middle, and then this just plugs into this side. And last but not least, we have a pulse ox that you put on your finger. Now this will go on your middle finger, and the cord will go facing up. So I will have Coley demonstrate. So the cord will go on top of the finger, and then this is going to go on this same side of the finger that she has it on. The only thing we have left to discuss is we're going to tape any access of this cord. So I will grab that, and you always have them just kind of stretch their arm out so that you don't tape up too much. We put a little bit of tape there, and then they can actually tape that to their arm as well so they don't get wrapped up in it at nighttime. And then I always advise that they also tape the nasal cannula right down here by the neck and right here kind of on the sides of the face so that this does not move at night as well. And then one more thing that Coley is going to have to do tonight when she goes to bed is she's going to have help putting her snore microphone on her forehead. Thanks, Chloe. I'm short, so she's having to help.
You're crowning me.
Dun, da, da, da. So she will also have somebody tape this to her forehead, and this is just going to pick up any snoring sounds. So
do I have to press anything to turn
you
it on?
do. So this particular sleep study, when you lay down for bed, you're going to actually press the event button in the middle. So if you want to go ahead and push that for me. Did you feel it depress?
Yes.
Okay. So you will press that when you go to bed. That does not start or stop the study, which is wonderful because you don't have to worry about messing that up. All it does is put a fine line in the study, just letting us know that you are initiating sleep. If you get up during the night for any reason, you push it again. And if you go back to bed, you push it again. In the morning, you push it, but it's not stopping or starting the study, so you don't have to worry about it not recording your night. And then the only other thing that we do with this is we give them a sleep log to fill out, and that just kind of lets them describe their night of sleep, and so that way the sleep physician that is actually scoring the study will have an idea if this was a good night of sleep for them or a not so good night of sleep for them, and if it's a not so good night of sleep, maybe we should try it again. So
I feel like I'm going to sleep great.
Bye, guys.